Now I would like to introduce Dr. Colin Ferness. And I'm sorry I skipped over your bio, but I did paste it in the chat, Jane. I was going so fast at the beginning and thinking, oh, I got to get all this right, and I went too fast. But it is there for people to read. And Colin, I will read yours if you want to start sharing your screen. Colin is an infection control epidemiologist and assistant professor teaching stream in the Faculty of Information at the University of Toronto. He received his PhD in the interdisciplinary field of knowledge management in 2010 and his Master of Public Health in Epidemiology from the Della Lana School of Public Health in 2014. Since the onset of the COVID-19 pandemic, Colin has been focused on matters of information and knowledge use in understanding and responding to this unprecedented public health threat. At the Faculty of Information, he has created 2 graduate courses, Pandemics and Information and Information, Misinformation and Health. Colin has also been retained as an expert witness several times in Ontario concerning COVID-19 emergency measures and public safety. In addition, Colin has been engaged in media commentary on a local and national level, having now completed more than 2,000 media interviews while advocating for improved understanding of the pandemic and better public policy in responding to it. So thanks very much for joining us, Colin, and for sharing your thoughts on trust and the noise of misinformation and how it applies to the pandemic, as well as, of course, to the other challenges we face.
Great. Thank you very much for the warm welcome. And obviously I have 2 key questions. Can you hear me and can you see my slides?
Yes, everything's good.
Excellent. Okay. Then we're starting off on the right foot. So I just have a very, very simple outline for today. 3 things I want to talk about. First of all, framing what we mean by misinformation and actually framing it in terms of it being incredibly subjective. And I think that's a really, really important piece, that we really can't talk about what's right and what's wrong nearly as much as we need to talk about how people are situated in thinking about what is right and what is wrong. And that kind of flows, I think, into talking about what do we mean by trust? Because these concepts of information and misinformation and trust are so carefully connected. And I have a definition of trust. It's not mine, but it's one that I think is enormously useful and thought-provoking. And then we can bring these 2 things together to say, well, if we're thinking about how people come to believe what they believe and who they trust, how can we situate that in terms of employment, in terms of employers, in terms of workplace? So those are the 3 things. And there's 4 books among many that have informed my thinking on this. I have to tell you, I poached a little bit from my grad course here and there. I wish we had about 40 hours to get into this stuff, because I think that's how long it would take. And I usually talk in 3-hour blocks, but I'm determined to do this just at a fairly surface level. I hope that will not be dissatisfying, because I think these topics can be unpacked and explored. But Hardin is where I go to for trust, and Chun-Wei Chu is very seminal for me in terms of what organizations know and how they use information. The Misinformation Age, great book in terms of looking at social forces, and then more of a quantitative look, Calling BS by 2 very talented authors for those who are interested in that. So that's I'm leading with the further reading. These are books that have certainly engaged me. So let's start with what we mean by the subjectivity of misinformation, and that idea of the noise of information. Really, what I'm trying to get at with the idea of noise of misinformation is that there are all of these competing narratives, all of these competing discourses, and as an individual, we've got to figure out which we tune into and which we don't. And again, it's not about saying that's right and that's wrong. We may have those views, we may be able to defend those views. That's actually not a useful way to figure out how we move forward in terms of understanding misinformation and trying to cope with it. So just from an epistemic standpoint, I want to start with the word positivism, which for some of you may be a very plain vanilla word, and for some of you may not be. Positivism is an epistemic perspective. It's predicated on science, scientific modernism, the idea that we can unravel every mystery scientifically. We can establish one objective reality. There is one truth. The value of gravity is 9.8 meters per second squared, and we've measured that and we know it. and we can say that's a fact, that's an objective fact. And when we look at the natural world and measuring the natural world, and this is really where scientific modernism came from in the 19th century, it really was unraveling nature's mysteries and coming up with these universal truths, these objective realities that we all share. And there was a view that we could figure out anything that way. And the problem with that is that it actually tends to fail really badly when we talk about the human world, the socially constructed world. For that, we need a different epistemology. And again, this is where a lot of people don't go, but I think need to. And that's to say, well, we can adopt an interpretivist lens, right? It's not the opposite of positivism, but it sits in conflict with it. And interpretivism is predicated on postmodernism. So it's actually a very new kind of epistemology, to be honest. We can call it a post-war epistemology. And it says, you know what, whether you like it or not, whether you wish it were the case or not, everyone constructs their reality. And that's done on an individual basis. And there's multiple possible truths to choose from. And so if we talk about living in a post-truth world, I think really what we're trying to say is that the differences, our ability to believe different things and conflicting things from our neighbors, is actually creating a lot of social tension and problems and, well, noise, right? So we construct reality on our own. We construct our own truth. And actually, we kind of need to embrace that. We can't deny it. It may not be ideal, but this is the way our brains work. And if we want to talk about the human social world, we actually need to understand that. And when we think about something like COVID-19, it's a biological threat. And so we can apply positivism to understanding how the virus works. But if we want to understand how people respond to the virus, then we actually need an interpretivist perspective. So there's two kinds of people who don't know the word positivism. Those who don't spend time thinking about epistemology, right? So it's just not something you think about. But also positivists. People who are absolutely committed to positivism tend not to be familiar with the term. And it reminds me of the cartoon of someone reaching or leaning into a fish tank saying to the fish, "How's the water, boys?" And the fish answering back, "What's water?" Right? So when you're immersed in something, you cannot see it, right? You cannot, because you can't conceive of not water in the case of fish, or not positivism in the case of a lot of people who are very, very oriented to science. I was trained initially as a positivist. My undergrad was in psychology at the University of Toronto, and psychology, when you take a positivist, research-oriented stance, it is very much concerned with uncovering universal truths in human behavior and human cognition. And there are some, especially when we look at biologically what's going on. But as soon as we start to get into the more clinical side of things, the more observational side of things, positivism doesn't work anymore. The greatest regret I have is that I didn't actually delve into epistemology as a young person. I was one of those positivists who never heard the word. And I think if I could go back and change anything, it would be that. So I wanted to provide this as a foundation to say, wherever you're coming from epistemically, here today in this chat, think about positivism as being this great way to understand the natural world, and a very problematic and ineffective way to understand the human constructed world. And so if we ask questions like, are lockdowns, why are we doing lockdowns? Why the protests? Why all the social conflict? Well, lockdowns are about safety. Lockdowns are about freedom, or therefore lack of freedom. Depending on who you are and your positionality, either or both of those could be true. Are vaccines about protecting, or are they about control? Well, those are two truths. And depending on your positionality and your perspective and your lived experience and what you hear from others, one or the other could be true. We could generate a long list of questions that ought to have one simple answer: why we do lockdowns, what vaccination accomplishes. But that's actually not the way that we work socially, and we can't deny it. We need to, as I say, we need to embrace that and try and work with that. So given that we have an interpretivist world, right? Given that humans will do this, whether you like it or not, we can say that there are multiple ways of knowing. And the first way of knowing we've already covered. It's the scientific way of knowing. It's through deduction. You start with a bunch of observations, and you deduce what must be true based on what you observe, what must be true. That's deduction. It's positivist. It's a very powerful way of knowing. And as I say, all my early training was hardcore in that area. But there's also what we can call practical knowledge. Practical knowledge is knowledge that you get from the world directly yourself. And it's actually the opposite of deduction. Induction starts with very specific things, specific experiences, and then you generalize those specific experiences to what you think must be true based on specific experiences. So it's the opposite of scientific knowledge. It can also involve what's called abduction. Abduction is the idea that there might be different possibilities. So the idea of fitting different possibilities to something, again, embracing or holding on to possibly multiple truths at the same time. So practical knowledge through direct experience is very, very different than scientific knowledge. And then there's two other ones. And again, I could do an hour on each one of these really easily, but I'll lump them together for the moment. So religious knowledge and story knowledge. Story knowledge is when someone tells you something, right? It's not what you read in a scientific journal or what you get in a class. And it's not something you experience directly. It's something someone says to you. And religious knowledge and story knowledge have a lot in common. They're not the same, but they have a lot in common. And ultimately, what they have in common is the storyteller. Like, who's the authority? Who are you actually choosing to listen to or choosing not to listen to? And the thing is, when you've got evidence about vaccination, for example, or evidence about masks and whether masks are effective or not, evidence about HEPA filters, ventilation, all these things that we have been fiercely debating, even though they ought to be simple questions with simple answers. The fact of the matter is that waving evidence at people, saying, look, here's the evidence, actually isn't very effective. And it's not very effective because for 3 out of 4 of these, it's completely irrelevant. If you're talking with someone who is a hardcore positivist, who is scientifically trained and can read those papers, the evidence works. And those are typically not the people who you're going to necessarily have a lot of conflict with if you are also trying to get people to do, what you think is the right thing from a scientific perspective. The other 3 are really quite resistant to that. You might as well be waving something written in a different language for people who are predicating their beliefs on their own practical knowledge or on what they have been told, right? Perhaps by a religious leader, perhaps by their dentist, hairdresser. I mean, it's that authority can be anybody, right? It can be social media. It can be people they've never met. It can be their immediate family. And we know that depending on demographics, socioeconomic status and demographics, we can start to characterize different populations according to where they get their news from, where they get, who they take as authorities. That's a whole other conversation. So I'm not gonna delve into that. I just really want us to get to the point where we can say, all right, there are different ways of knowing. And if you pick a random person off the street and ask them an arbitrary question, their answer could come from any of these ways of knowing. So they're all in operation, right? And there's no point trying to rank order them or decide which one's better. They're all there. And I think that's what's really important to cope with. So if that's the case, then the quality of our knowledge, and I know quality is a problematic term, but bear with me for a moment. The quality of our knowledge depends on who we take as an authority and how mindful we are about this. Do we pay attention to what we hear? Do we think critically about, what would be that person's basis for saying that, for knowing that, for trying to persuade us? What are their motivations for that? Some people are more critical thinkers than others, so there's going to be a lot of individual differences there. But what's common is that the quality of our knowledge depends on who we decide we're going to listen to, who we take as an authority. They can be individuals we admire. Of course, they can be pundits on Twitter we've never even met. But they can also be institutions that we're socialized or encultured to revere. So when you're a little kid, your teacher has huge authority because you as a child, you understand what school is, and everyone socially is reinforcing this to you that, the teacher is the person who's there to help you learn, and so what they say must be right. As adults, we make our choices, and part of its influences we've had, part of it is our lived experience and ways in which we decide whom to respect and whom to ignore. So those institutions, they can be religious, they can be social, they can be our employer, they can be all manner of things that we can decide that we are going to revere or we are going to respect. Patrick Wilson adds a lot to this in his very unreadable book. I do not suggest you read it, called Secondhand Knowledge, An Inquiry into Cognitive Authority. I struggled with it, but it's got some really, really important ideas. And I think it can be boiled down to something a lot simpler than the way Patrick Wilson set it up. Although his writings, I don't mean to be mean, his writings are really valuable. He would have profited from a good editor. Cognitive authority essentially really encapsulates what we've just said. Most knowledge comes to us secondhand, right? Scientific papers that we read, story knowledge, religious knowledge. Yes, sometimes we put our hand on the hot stove and we burn our hand and we learn things directly, yes. But most of it comes to us secondhand. And if it comes to us secondhand, then cognitive authority becomes this enormous, enormous influence on what we say we know, what we think is correct, what we think to be true, and what we think to be not true. And so going back to that idea of the noise of misinformation, take 10 people and put them in a room and think about the variability you might get in terms of who their cognitive authorities are. Put that on top of all the different ways of knowing. It shouldn't surprise us that even on things where we ought to have convergence, ought to have a straightforward understanding of things like vaccines, for example, or masks, for example, it turns out we don't. We really, really don't. There is a massive subjectivity. And I'm not celebrating this. I'm not telling you that this is a fantastic thing. I'm telling you simply that this is the way we operate as individuals in a social collective. And the COVID-19 pandemic has actually really, really brought this to a very, very problematic place in the foreground because it's very hard for us to come up with coherent policy. It's very hard for an average person to figure out, in many cases, whom to believe. And that's a real mess. It's a mess that we're in right now. But this word trust, I circle it there. This word trust is enormously important. And in the thinking that I've been doing over the last couple of years, I have this background on one hand in information and knowledge use in organizations, and on the other hand, epidemiology. And I've been struggling at the intersection of those. But one thing that has really percolated for me that allows me to connect these things and provides actually a lot of basis for what I'm telling you about today is this word trust. And so that takes us then to, well, okay, what do we mean by that word? Let's think about how we conceptualize the word trust. Trust is one of those difficult words, like intelligence. We use them all the time. And then when we try and pin them down, we have a hard time. But we can see evidence, right? We can absolutely see evidence. If we think about the United States election, here's an article from The Guardian just from a couple of months ago. Still, there's a substantial number of people in the US who just don't think the election came out properly. And a proportion of those said they've actually lost faith in American democracy, more so Republicans than Democrats. 10% never had any faith or any trust in the system. 49% still said they still did. 49 is pretty high, but it's actually on one hand. On the other hand, if you're actually thinking about, well, if that underpins our entire system of governance in the United States, that's actually kind of low. It's not quite a majority. So that's concerning. If we think about the phenomenon of vaccine hesitancy, and my very last slide, which is an ad from vaccination, or rather an anti-vax ad from a very long time ago, brings us full circle to this idea of vaccination being a flashpoint for trust. This great article from The Atlantic that says, look, maybe it's not about the vaccine. Maybe it's actually about trust, right? The world over, people feel lied to, unheard, and pushed aside. This is for many people the unspoken outcomes of globalization. They no longer have faith in their leaders. They're lashing out against governments and health officials, in some cases by rejecting the COVID-19 vaccine. And again, you can wave all the evidence you want. You can show all the data you want about the proportion of people who are hospitalized, ventilated, who are unvaccinated versus vaccinated. We can collect all that data, but none of that is actually going to solve the underlying issue, which is cognitive authority and trust. So it's not that I've got data to wave at you. It's I've got to figure out who you might be willing to listen to. That's the problem I need to solve. Who might you be willing to listen to who can tell you a story about the vaccine? That is probably a more effective way to change the minds of millions of people who, when they hear it from government, when they hear it from certain institutions that they don't trust, and therefore reject the vaccine. This one gets even more. I mean, if you had any doubts about the relationship between our understanding of health information and the broader issue of trust, this is pretty wacky. And the association is so strong, we can't ignore it. This isn't one of these things where we found a statistical significance and therefore we can brag about it even though it doesn't much mean anything. By a factor of 12, people who are unvaccinated are far more likely to think that Russia's invasion of the Ukraine seemed like a good idea. Of course, the ostensible purpose of the invasion was to root out neo-Nazis, and I have no doubt that there are neo-Nazis everywhere, in some proportion, Ukraine notwithstanding. But I think people who take more of a mainstream view don't buy it. They look at Russian belligerence quite differently. But by vaccination status, that's really quite remarkable. So what does vaccination status and political views have in common? Trust. And on a more personal level, I have noticed, and I'm not the only one who's noticed this, on Twitter, that those who are engaged in troll behavior, and troll behavior is attacking people whose views you don't like, right? And it's really trying to chip away at trust, right? There's a lot of name calling. Why? Well, because that undermines trust, right? If you can reduce someone as a person, as an individual, to being despicable, then you've got a good basis to perhaps not trust them. So those engaging in troll behavior frequently identify with cryptocurrencies. They don't all. Now, not everyone who thinks cryptocurrency is a great thing is a troll, and not every troll is heavily invested in Bitcoin. But the Venn diagram of those two things are surprisingly connected. And that shouldn't be surprising. I'm not an economist, and so I don't really want to talk about cryptocurrencies as a good thing or a bad thing. But I think we can agree that as an alternative system of currency, they provide a means of existing in the world where you can actually uncouple yourself from trust in government, right? Because all currencies are backed by a government. So if you ultimately are unwilling to trust any government at all, right? If trust is the big problem you have, or should I say mistrust, cryptocurrency might actually seem like a really, really good thing. So I want to be careful. I'm not trying to paint everyone who likes cryptocurrency as a bad person at all. I'm just pointing out that the relationship there, my unscientific observation, is quite consistent with these ideas of the information or misinformation people have and it being related to or explainable in terms of underlying trust. And this is one thing that I just absolutely loved. If anyone, this was someone's post, not mine, if anyone gets in your face and asks why you're wearing a mask, just say, I wear a mask because of the deep state's facial recognition system, right? So the person who's telling you to take off your mask is saying so because they don't trust the health authorities or the government or the scientists or anyone who's telling you mask is a good idea. And if your response is, oh no, the distrust is on an even bigger level, right? That's actually really quite baffling. And it apparently it has been effective at getting people who are hostile to masks to sort of shut up, look a bit baffled, and maybe wander away in confusion. So that's an interesting way to engage with someone who is trying to persuade you of a course of action based on mistrust. To say, no, I mistrust as much as you, or even more than you, and that's why I'm wearing a mask. Wear a mask because you distrust, as opposed to wearing a mask because you do. I have not had a chance to do that yet. I haven't had a single experience yet where I have been accosted because I've been wearing a mask. Maybe that's because I'm just in my own basement a lot of the time, but it hasn't happened yet. But this is one I might try. All right. So how do we define trust? If I've persuaded you that trust is worth thinking about here, that maybe trust is actually a really important part of the mystery of misinformation, we really need to wrap our heads around what we mean by that. And again, like the word intelligence and a few other words, we use them a lot, but then when we try and pin it down, it can be difficult. So how do we define it? It is a really complex social construct. There's no doubt. There's no question. It's hard to define because it's a hard term. It's a complicated term, I think. And we actually have to decide whether we want to talk about trust as a cognitive issue. Is it about how people think? Or is it an affective issue? Is it about your emotions and how you feel? In other words, do you trust someone emotionally or do you trust someone cognitively? Well, it turns out that there's philosophers on both sides. And, I am not a moral philosopher and I don't even play one on TV, but I did manage to engage with Hardin on Hardin's work on this. And I love Hardin's answer, Hardin's definition, which is explicitly cognitive. It's absolutely a cognitive answer. Hardin calls it encapsulated interest. And that's actually not very helpful on its own because it doesn't necessarily mean anything. So let me try and explain it. Encapsulated interest means that if I think that your self-interest includes or encapsulates my self-interest, if our Venn diagram of my self-interest is inside the bubble of your self-interest, then I will trust you. So if I have, in other words, I would have some belief that you have some incentive to keep my trust. Now, that's not the same thing as having overlapping interests. We may have shared goals and we may work collaboratively toward those shared goals. Great. That's not the same thing as trust because we may be pursuing those goals for very different reasons. In other words, once we get to the finish line, maybe you will turn around and pull the rug out from under my feet, right? The enemy of my enemy is my friend within a certain domain for certain purposes, but that doesn't mean that I trust them, right? You can have friends that you don't trust. So trust is very much an appraisal of what is your self-interest? What is your motivation for doing and saying the things that you're doing? I'm going to examine that and I'm going to draw a conclusion as to whether my self-interest is contained within your self-interest. Is my self-interest inside your self-interest? And that sounds perhaps like a rather complex or ornate definition of trust, but the more I think about it, the more I come to the conclusion that it's actually an enormously useful yardstick for understanding this really complicated term. I'd also like to point out, as Hardin does, that the bar for mistrust is much lower. You don't need a complicated definition for mistrust. It's simply an inability to get to trust. In other words, if I cannot locate my self-interest within your self-interest, then I have no basis on which to trust you. So mistrust comes a lot more readily than trust, right? Mistrust is, I won't say it's the default because I'm not sure people come up with a judgment one way or the other all the time. What I would say is if someone's going to come to a conclusion, mistrust is a low-hanging fruit, right? It takes a lot more effort to think about someone to try and construct what you think their motivations are, what you think their self-interest is, and then to try and position your own inside that. There's more that Hardin has to say about things like thick relationships. In other words, if you have overlapping networks of relationships, that can engender trust. So in other words, a community of people, a group, a collectivity of people, that structure, that social structure can encapsulate, or so rather can engender trust because it provides more fodder for you to understand or appreciate or at least imagine the self-interest of other people. In other words, it lets you make some assumptions about norms and values that they have and what they're doing because you've got more frames of reference. In other words, the enemy of your enemy may be your friend, okay, but the friend of your friend is someone perhaps you're more easily able to grow to trust. And then we can think about trustworthiness as a characteristic, right? As a characteristic of a person or a characteristic of an institution. And we can divide that. We can think about it in terms of cognitive trust. I'm willing to listen to what you have to say, and I will think about it. Or behavioral trust. I'm willing to do what you tell me to do. I'm willing to act on your advice. And they're not the same. They're not the same. Again, we could deconstruct that and explore it a lot, but then we would be here until the wee hours. I don't want to do that. There are trust motivators, just like thick relationships, where if you have those relationships, you can understand people better. Cooperation, and we are social creatures. Humans do cooperate quite readily. We don't need trust to cooperate, but if we do cooperate, that can build trust. In other words, again, we get to know people better. We get to understand what we think their motivations are and what we think their self-interest is, and then we're able to compare that to our own. So, and it's a virtuous cycle. Successful cooperation can engender trust, and trust, in turn, can engender more cooperation. And so if you think about social structures where cooperation happens, that's where you have opportunities for trust. There's also the idea of reputation, the forward consequences of being a trusted person. Now, Hardin is clear on the reputational side. Distrust isn't a decision. I don't decide to distrust you. It's simply a consequence of perceiving someone to be untrustworthy. So it's distrust as an outcome rather than a conscious decision. And so that takes me to trying to stitch these things together, right? To say, well, if misinformation and information, what we believe to be true, depends on whom we trust, and we have this idea of trust as encapsulated self-interest, well, we can start to think about that employer-employee relationship. Now, I don't want to be naive about this. And some of you, I mean, quite rightly could roll your eyes and say, yeah, trusted employer, there's an oxymoron. And in many cases, of course, that's true. I don't want to be naive. I don't want to be trying to present this through rose-colored glasses. I understand very well that management gets the unions it deserves. And I have been involved in enough cases as an expert witness on conflict between management and unions to understand actually that trust may be really ultimately very missing in many workplace environments. But that doesn't mean it has to be. And so I really want to talk about the opportunity or the potential when I talk about the concept of the trusted employer. If you've drunk my Kool-Aid, then you'll accept that those who are trusted can have an outsized impact on what we believe. Those whom we trust, we will accept as cognitive authorities. Cognitive authorities will tell us things that we are likely to believe because of the ways of knowing that relate to listening to people whom we trust. So this pandemic has produced dangerously fractured realities concerning what's safe, right? That interpretivist perspective of multiple truths, of us constructing our own reality. And there has been a noise of conflicting perspectives. Even among positivist scientists, there is so much disagreement about some really basic questions. And so that turns me to not science, actually, but the private sector, to Edelman, which is a PR firm. They're a very big, successful, global-ish international PR firm. And they've been doing research, actually, for a few years, many years, actually, which they call the Edelman Trust Barometer. And it's a survey they do every year. And they have found, and I want to show you some of their data, they've found that employers have emerged as higher trust entities during the pandemic. Trust in employers overall, I can't speak to any specific workplace, maybe gotten worse in many workplaces, but overall, it has gone up. And my own connecting the dots here has been, well, when the pandemic hit, when the crisis hit, yes, some people lost their jobs. Some employers behaved badly. Some employers disappeared altogether. Of course, there's no end of horror stories. I don't want to be naive. But for many, what happened was employers said, you're going to work at home because it's safer, and we're going to support that. Right? We're gonna continue paying your salary, and we're gonna put up with lower productivity, and we're gonna do this because it's safer. That I could, as an employee, say, their self-interest, which is continuing operations, includes my self-interest, which is staying safe. So it seems to me that remote work accommodation has provided a really powerful mechanism for me to look at my employer's self-interest and conclude that my self-interest is contained in that. That's not going to be true for everyone all the time, but we have these data from the Edelman Trust Barometer that says in Canada, trust in employers has gone up. So here's this is my favorite data visualization. You can see in lighter gray is the 2021 data, and in 2022 is the darker triangle. And there's three measurements here on two scales: competence, which is on the horizontal axis, and ethics, which is on the vertical axis. And they've asked questions about your people's perception in government, in non-governmental organizations, and in business. Right? And you can see that it shouldn't be a surprise that our faith in government was low in 2021 and got even lower in 2022. And if you look at some of the policies that we've had around pandemic management, that shouldn't be a surprise. Or if anything, perhaps we're surprised it isn't even worse. But look at the other side of the triangle. Ethical perceptions for business and NGOs have gone way up. Competence for NGOs has gone up. Competence for businesses, if it slid only a teeny tiny bit. So if we're looking at who to trust, and media seems unchanged, if we're looking at who to trust, government is losing. NGOs and businesses are actually winning. And that surprised me. This gave me a lot of food for thought. Now we can also look at this question. Most believable sources of information on healthcare issues. So now we're like right in the money here. Who do we believe? So what this says, if you look at the very bottom, I will never believe it's true if this is the only place I see it. It's actually lowest for your employer, right? You're least likely to outright reject what you are heard from your employer, even if that's the only place you've heard it. As far as seeing something here once, if I see it here, I will automatically assume it's true, rather, is actually fairly high for employers, not the highest, third highest. But it is highest for if I see it once or twice. In other words, if I see a message repeated. And then if you sum those scores together, and I don't know what the statistical basis is for summing them, I actually think perhaps they should be multiplied. Anyway, you see that my employer actually comes out pretty high, right? Provincial health authorities aren't here. National health authorities are. National health authorities seem to work pretty well. And that's interesting. And I think it's because national health authorities are not actually running your healthcare system. And so there's perhaps an idea that they're free to be more critical or free to be more honest. But this is pretty striking. Social media is way down for most people. Major corporations, traditional media. I'm more likely to believe things from my employer than from traditional media. That's remarkable. That's remarkable to me. Not only that, a large proportion of people expect their employer to play a meaningful role in good health, right? So that's the question. I expect my employer to play a meaningful role in making sure I'm as healthy as possible, and so that's a pretty high number. And then these other numbers are a little bit lower, and actually remarkably low for mental health support and preventing burnout. That actually surprised me too. But these three tables or these three data visualizations taken together say that there's something here. There's an opportunity here. There's something tangible where people are willing to say, yeah, I'm going to listen to my employer. I'm willing to listen to my employer on matters of health. And that's something that I haven't really heard discussed. We hear it from public health authorities and individuals and social media and my dentist hairdresser, but we tend not to hear about that from employers. So I want to tell you about the tragic case of one organization that I've gotten to know, and it's a medium-sized NGO actually, and they're doing it all wrong. And this is what I want. This is what I want employers to avoid. They started by just locking stuff down, and they were super cautious, and they had a lot of rules around people being able to access the work site, and that seemed awfully restrictive. I mean, really conservative. And then they flipped. They said, okay, you know what? Now we're done. We're done with this. We're done with COVID, as people sometimes say. Everyone back in the office, and we've got a whole bunch of people who have contact with the public, and we're not going to put N95 masks on them. We're not really going to talk much about that, and maybe they'll wear masks or not, and we don't really care. And it gets worse because the senior management are being pushed into external stakeholder meetings and events where no one's wearing a mask. And so what happens? The entire senior team gets COVID and they're sick. And the CEO gets COVID but won't stop coming to work because the CEO is a very driven person and is there coughing in the office without a mask on. To me, this is sort of the worst case nightmare scenario of an employer squandering an opportunity to elevate the health of people and to elevate that trust. Because the middle managers who are literate enough to kind of connect the dots here, they may never trust leadership again. So this is trust in healthcare moving absolutely in the wrong direction. I've been asked twice now, only twice, to speak to organizations about COVID safety, to present, to try and educate people, to provide a little bit of hopefully understandable and accessible literacy on what COVID is and what it's doing and how to stay safe. And that strikes me as a very positive thing for employers to do, to say, if we have a channel, a communication channel with our employees that they're likely to listen, we should try and use that. We should do the opposite of this tragic case. And so what I think, the kinds of messaging that I think is really urgently needed to be supplied by employers, because I think people urgently need to hear these messages amidst the noise of misinformation, is COVID-19 is not a respiratory virus. It has a respiratory phase. Okay, polio gives you a sore throat, but we don't call it a respiratory virus. So COVID-19 is a vascular neurotropic disease. We've got to change the channel on this. It's not the sniffles. It does things you can't see that are pretty bad for your body. Fortunately, not to everybody. But if we can't change the channel on that, if we can't trust people to reframe or get people to trust us to hear that we need to reframe what this disease is, we're not going to actually design the right interventions. Vaccination reduces the risk of severe illness. That's really important. There's a lot of people saying, look, there's vaccinated people are getting sick, and they are. The virus has outmaneuvered us, but vaccination does reduce the risk of severe illness, and we should want to reduce the risk of severe illness. That we have a serious risk to children under 5. No one seems to hear this. This is, I think, I can bring myself to tears when I think about this too much, how little concern we seem to have for children under 5. This should be the group we are most worried about. But when we have mask optional policies, or the story of the NGO, a lot of people who work in that place have small children. Those children can't be vaccinated. Children under 2 are at a very high risk of ending up in hospital. And watching a baby struggling to breathe is something I never want to see. And because I'm not a clinician, I haven't had to. But that is the stuff of nightmares. Who will hear this? How will they hear this? From whom will they hear this? I think employers have an opportunity to provide this. And 95 masks, I see more and more out there now, but I still see a lot of people wearing blue surgical masks, which are great for droplets with great big gaps on the side. They're way better than nothing, absolutely, but they're not what they could be. And the idea that they need to fit well. I can teach you how to wear an N95 mask, and I can teach you how to do a DIY fit test that'll be pretty good. Not perfect, but pretty good. And that education's missing. I don't see employers doing it. I don't see anybody doing it. I think that's a bit of a problem. How to swab, actually, what's not on my list, how to do a proper swab for a rapid test. These are things that employers could be teaching. These are things that employers could be conveying. And I think in many cases, they'll have a receptive audience in ways that government won't, in ways that corporations won't. And finally, gosh, indoor air quality, it can be measured and managed. Something, again, that we're ignoring. We're not going to get this done on a regulatory or a legislative basis if people aren't asking for it, and people aren't going to ask for it if they don't understand it. So again, I think employers, I'm not going to say they've got an obligation to do that. I don't think I have the standing to make a statement like that, but I do think they have an opportunity. And that's really my message today, is that employers have an opportunity to take advantage of what is a high trust or high potential trust relationship, communication relationship, to try and do what other communication channels can't. And this is a contentious thing to say, because I am very pro-vaccination, but forcing vaccination is running in the wrong direction. Why? Because it actually reduces trust. We should be levering trust rather than reducing it. No child should have an unvaccinated teacher. No hospital patient should have an unvaccinated healthcare worker. But we shouldn't compel vaccination. We should accommodate those workers in different jobs. So teachers can be doing virtual school, and healthcare workers who are trained to work with patients can work in the kitchen or the laundry room instead. And we should actually really, really respect what could be fear, what could be mistrust. We should respect that and work on them from a trust perspective. Because you may compel vaccination in many, but what you are doing, what you are losing, is the willingness of people to listen to all the other things. So if you compel vaccination, you actually destroy a trusting relationship. And that does, you get the vaccine in many arms, but you actually, I think, lose a lot more. And I think there are ways that we can persuade people, and we're not trying. We're really not trying. I've been an expert witness on a number of cases around mandatory vaccination, and very rarely has the employer said, we provided educational materials. That's actually not on the menu. It typically isn't. And again, often these are unionized environments where there's already a lot of conflict, but that doesn't mean the employer doesn't have an opportunity, in my estimation. And so I just close with the idea that forced vaccination as an example, right, of ultimately, this is the ultimate trust-distrust thing in a workplace situation where the employer says, I need to forcibly inject you with a substance, which is what people hear if they don't trust vaccines. And so this particular poster is from the Montreal smallpox epidemic of a century ago. And you see there's law on one side and science on the other side, and the worker trapped in between, right? Outrage on personal liberty. This is an anthem to mistrust, right? The employer is not in this picture, right? If the employer were here, they would be saying, I want you to be healthy. I want you to be able to work for me. And to do that, you need to be healthy. And if I say that as an employer, I'm demonstrating encapsulated trust. Your health is important to me for reasons that are important to me. And so this is nothing new, and I don't think it's ever going to go away. And so I just want to wrap that up by saying employers and trust and misinformation are so tightly bound together. It's easy to misunderstand, but it's also, I think, once we untangle this a bit and understand this relationship, it actually presents opportunities. opportunities to elevate, opportunities to dispel misinformation, to create trusted communication channels, and therefore make smarter, more enabled people who then will be safer, happier, and healthier. So that's what I've got.
Wow, that was a lot of really interesting information. I'm ready to sign up for the 40-hour course, but I'm not sure we can handle that today. And I took a bunch of notes, and I don't know if anybody has any questions. I don't see any in the chat, but I thought the comments around how easy the mistrust bar is so much lower. I was wondering at the time, do you think it's like, do you think people are just generally more mistrustful now, and is that because of the flood of information of mixed signals, or so my two questions are, I guess, yeah, is everyone just guarded and doesn't believe anything? And then I'm also the light you're shining about that employers are trusted. I guess I'd be interested in some dialogue on that, but that there's an opportunity to gain trust, and are there strategies to gain trust that we could learn from or think of?
Sure. So, I mean, you're asking questions that, I mean, you're asking questions that require expertise I don't have. Why? I wish I were a sociologist, but I'm not, and I'm not an occupational health and safety person. And I think these are actually really vital questions from a labor relations standpoint. I don't have experience there. I know enough to know that there are trust issues permeate workplaces. I can think of one place I worked where it was very obvious, and I was trying to do health behavior interventions. It was very obvious that one department absolutely trusted management, and another department, a couple floors below, absolutely did not, right? So it's a complicated landscape. And I started with that, I wanted to be clear. I don't want to be naive. I don't want to say, hey, everyone trusts their boss. This is good. No, I think you have situations where that doesn't exist. And often they're unionized situations. But let me put the rose-colored glasses on then and say, despite all of that, it seems to me that if we look at that definition of trust, and I can simply cleave to that and say, hey, as the employer, here's what I'm doing, and here's why it's good for you, and here's why it's good for us. Like, actually communicate that way, provide that way for people to do the mental arithmetic to go, oh, okay, I don't trust them about a whole bunch of things, but I will trust them on this. Because people are able to do that. You can trust, and to talk about trust, we could have spent more time on that. You can trust people or agencies for some things and not others. It's not an all or nothing thing. And so perhaps I should have had a slide on that. There is, I think, the opportunity to have a trusted tendril between two entities where there's also a lot of mistrust as well. And so that's the piece. That's probably the piece right there that I don't think we have to say, no, you know what, we've got a union and we're always at loggerheads and we can never agree on anything. Well, but maybe the conversation's never actually been tried in a situation where there is common ground, where what's good for you as an individual is actually also good for the company. And if we can frame it that way, we might make progress. I can't promise that'll work. So as I say, I don't want to be naive, but that would be my response to people who say there is no trust in this organization. We can't make use of this. It's like, well, I think you can try. I think you can try just by cleaving to that idea of communicating in a way that demonstrates encapsulated self-interest.
Mm-hmm. Yeah, I think that when you're talking about the thick relationships, and I think that workers and supervisors and senior management, if they're all breathing the same air, like if they're all at work together breathing the same air, and hopefully that thickens the relationship to some extent. But I'm also Kevin, you probably have a question, but I'm also reflecting on U of T, because a lot of people we follow these days are from the DLSPH or the university. And the university last year was very public about, we're going to have 6 air changes in every single assembly room that we have, right? And that was very public, and I was really impressed with the university. going public. But then there was an issue in the fall whereas, well, wait a second, let's measure that. Where are the measurements, and what is that true? And then the Faculty Association, even right now, right, challenging the administration on the mask mandate. So
yeah, that story, I mean, that story is one of, they started out by doing it absolutely brilliantly, I think, in terms of being transparent, saying, we've got this expertise, we're going to tap this expertise. We don't care that the province is denying airborne transmission. We're going to go and fix the air because that's what our experts are saying we do, and remote work and all these safety measures. And I think trust was high. And then, then some difficulties emerged, as you said. And most recently, oh, we're eliminating masks on May 1st. And we're not going to even pretend that it's science-based. We're going to schedule an end of the pandemic. And then they really, I think they actually managed to really lose a lot of trust. Could they build it back up again? I absolutely think they do. They could. I think any institution that's done that can simply turn around and say, you know what, we're actually going to tie our policy to wastewater levels, because we understand that that's what we're going to do. Everyone watch wastewater levels, because that'll tell us if COVID is high or low, and that's going to be our yardstick. And I think that would actually be a very effective way. And I think they could still do that, and I hope they do.
Thanks. Kevin, do you have a question?
Yeah, just want to thank Dr. Furness for really distilling it down to some really clear, simple messages. That was fabulous, the way that all kind of came together in that final finale, so to speak. It's just the question, really, and I'm a bit cognizant of time now, is some time ago, I asked a trusted colleague from the US, we're in a bit of a mess, aren't we? China invoked airborne precautions in January, just after the start of the pandemic. And look at where we are now. We've been lobbying for airborne precautions, and look how long it's taking. And she said, I think it really comes down to epistemic trespassing. And, there's kind of two different thoughts on that. You really want collaboration. You want people to go between swim lanes and collaborate, for sure. But, epistemic trespassing can be a real hurdle, and I guess it can also break down trust. I don't know if you had any thoughts on that. I mean, there's probably a lot that can be said on it, but I just wondered if you have any thinking there.
Well, I've done a talk on that, actually, a much longer one. The answer has to do with interdisciplinarity and a commitment to that, to say that, there's a difference between a team of experts and an expert team. A team of experts are all talking over each other, and trespassing is actually a really relevant construct. An expert team is able to ask and answer questions that no individual could actually ask or answer, right? It's actually fundamentally reframing the problem. But the talk I did really gets down to what's expertise? Like, what do we mean by expertise? And that's really problematic. And I worry that infectious disease physicians are stampeding in the wrong direction, and infection prevention control people in hospitals are stampeding in the wrong direction, and engineers sometimes are stampeding in the wrong direction. They've each got something useful, but within their epistemology, it's still dragging them the wrong way. And so, for me, I think, if I were in charge, well, I guess we'd all be in trouble, but if I were in charge, I would replace our chief medical officer of health with an independent body that is actually interdisciplinary, that's got a bioethicist and a nurse and a social worker and an infectious disease person and I would have their deliberations and the minutes of their meetings publicly posted. And I would have them issue recommendations to government, and then government could accept or not accept the advice, but they would be unable to manufacture the advice or influence the advice. And that would provide the conditions for an expert team to exist. It wouldn't guarantee. Again, if you've got a team of experts and not an expert team, you still don't win. But you could have a structure there that models interdisciplinary thinking. Because I think you're bang on. Epistemic trespassing is which I call a team of experts, right, as opposed to an expert team, is an enormous problem. And when experts disagree, as experts have, don't forget, there are a lot of people in public health were absolutely opposed to rapid tests. Absolutely, the microbiologists didn't like them for one reason, and public health physicians didn't like them for one reason. And we had the same discourse around home pregnancy tests in the 1970s. Exactly the same discourse. Oh no, they're not appropriate. They're not going to work. They're not, oh no, this is going to be a real mess. It's no substitute for medical care. And it turns out that home pregnancy tests are a great thing. And it turns out the rapid tests are a great thing. But when the experts can't agree, it becomes very difficult for government to say, okay, sure, yeah, let's go ahead and do that. What you really need is an interdisciplinary team to wrestle with the question transparently and come up with a unified answer. Even where there's uncertainty, you can still come up with a unified answer and present that. So I think we need different structures. We need different decision-making structures as the facilitating conditions. And then you need to populate those structures with people who are willing to be interdisciplinary. It's a tall order. And I don't know of any structure anywhere in any government anywhere that actually has achieved that. So it's not easy, but also don't know who's tried.
Thanks, Dr. Ferness. It'd be interesting. Is that recorded, that talk that you gave on that, by any chance?
I think it is.
Maybe you can share it with us later on, and we might kind of share it with our audience. Thank you.
Yeah, I think it was. I think I can find a link to it. Yeah.
Great, thanks. I was just going to comment, and then we need to move on. But that Oak House is a bit of an NGO, and we actually are proud of being multidisciplinary. Although not saying we're trying to build trust with these 27 episodes of COVID, actually, to bring the science, but also talk about the impact on people and and how and different approaches. But but I think Simon, you had a comment. Did you put it in there, or do you wanted to make a comment about epistemic trespassing?
It was just a comment about learning, and this thing we have often heard that we've learned a lot about respirators in the last couple of years, and it was the fact that those in the business and occupational hygiene experts have known that information about respirators for decades. It's been standard science, but it's not been known particularly by those in infection control or other areas because they never had to deal with that before, and they're treating this as if it's something novel and an exploration, whereas in fact if they'd accepted such things as the precautionary principle and other factors from the start, that this is not learning, it's well-established facts. Yeah. Thanks.
Thank you, Simon. Okay, I'll let Kevin introduce Victor, and thanks again, Colin.